here's what your therapies are based on and why you do them and when you would do them. So we already talked about the importance of biomarkers relative to the 3 phases of healing. Well, I call this the 4 dimensions of an injury. So here's what happens. The first dimension, an injury will naturally progress through the 3 phases of healing if there's no further irritant. Is that the real world? No, because we have to do stuff. We live dynamically. Okay? Number 2, second dimension. There's further irritation can initiate the inflammation. Further irritation can initiate the inflammatory response with tissue that has progressed into the repair phase, creating an inflammatory cycle while the repair cycle is in progress. So the first thing that happens during the inflammatory phase, what's your therapeutics? Inflammatory, pain, inflammation, muscle, okay? That's your therapeutic protocol. Now, they go into the repair phase. What therapies are you going to do in the repair phase? Well, they're based on active, passive, joint range of motion, right? But what did we also say? You could still have biometrics that are still inflammatory based. So if you have biometrics that are still inflammatory based, what therapeutic protocol do you use? You use inflammatory, but then you still want to try to start the active, passive, and joint motion therapies. In addition, what's your limiting factor? Because you want to start that in the repair phase. Can the patient do it? Can the patient do it without re-injuring themselves? So a lot of times we'll start with passive motion, right, before active. Active is going to be the last one we do. So typically we'll go into more passive motion, stretching, and joint motion therapies in the repair phase. So because we can get away with that even if they still have pain without re-injuring them or flaring it up, right? So that's the point here. So the person can totally be in the second phase of healing and you're treating them from both phases. Because why? What's the number one factor that you have to have documented? The biometrics. You better have the biometrics for that pain and inflammation if you're going to do therapy in the repair phase for pain and inflammation and bill for it. You better have it documented. What's the third dimension? Further irritation can initiate an inflammatory process with tissue that has progressed into the repair phase and tissue that has progressed into the remodel phase. Separate and distinct cell damage. Any injury can have all 3 phases of healing present in cellular tissue if there is a continued irritant or exacerbation. You can have all 3 going on simultaneously. You can have pain and inflammation. That tissue could have been progressed into the repair phase and you could have re-irritated, creating different pain and irritation, as well as tissue that's now in the remodel phase. So you can have all 3 biomarkers going on where they require certain, so you go, well, what therapy would you use? Well, it totally depends on your biomarkers. What's the first objective? Get them out of pain and discomfort, muscle spasms, then increase their active and passive range of motion, then increase their strength and elasticity. That's my goal. If I can go through that route, I want to go through that route, my main limiting factors are going to be what? Pain or re-exacerbations. So I may not want to be doing remodel phase therapy, even though I have some tissue in the remodel phase because they're still too pain insensitive. And it might have been from a second re-injury. Do you get my point? In other words, it's not black and white, it all overlaps. And what's the defining characteristic? Your biomarkers. So you got to think, what are my biomarkers? And go, okay, what phase of healing am I in relative to my biomarkers? And what can I do with this patient relative to my biomarkers? So the fourth dimension, depending on the irritant or exacerbation, you can have all 3 phases of healing taking place simultaneously, while previously injured tissue is in a separate and distinct phase at different intervals of time. I just call that vertical and horizontal healing. And so that's a question I commonly get from chiropractors is they'll say, well, what therapy do you do and when do you do it? Well, it's totally based on their biomarkers relative to the 3 phases of healing. And my first objective always is to get them out of pain and inflammation, decrease their muscle spasms. As soon as I can do that, I want to move them into the active motion therapy, passive motion, or not active therapy, but I want an active range of motion, passive therapy, joint motion, as well as continue with any pain or inflammation or muscle spasms. And then soon as I can, in the remodel phase, I want to get into the active therapies and the passive therapies, elasticity. But the limiting factor is going to be, do they have the pain and discomfort? And I have to start small to make sure they don't just jump right back into a re-exacerbation. So they can have all 3 phases of healing going on simultaneously what therapy you would do would be dependent on the biomarkers. But you would still want to follow the protocol. Obviously, you wouldn't want to start active therapy and do a lot of active therapy if they're still weak and in pain and inflammation. So there you have it. That's how I'm going to apply my therapeutic protocol and the reasoning behind it.